Okay, call to order, roll call, we're both here. Mission statement, we anticipate and provide services to meet the healthcare needs of the people we serve. Financial reports, review of monthly financial statements of operating entities in the district.
We don't have August closed yet. I mean, I don't even have the August revenues. I've received the payroll, but I haven't received anything else. So what we can review is just the July. We can go over it in a little more depth than what we did at our board meeting last month, but because we don't close the month until about I mean, the idea is to try to get me all the information by the 12th, or more or less, but I usually get it around the 15th. I get the payroll's coming now, very, very good, but I get the revenues from medical health billing services up in Hayward. I get them anywhere from the 15th to the 17th.
Yeah, she has to wrap up and close her books as well, so.
Yeah, and in 2 weeks, that's fairly reasonable. So, I mean, to ask any more of that, you know, but, so at this point on September 11th, I can't have August done by that point.
Dumb question, I know our meetings for the finance committee are scheduled, if we schedule them later in the month,
Then we could have a review of the current month before we take it to the board meeting.
So that would put you 1 week before, the only later in the month would be 1 week before, so we can look at the calendar.
would you look at that and see if that's doable? Do you have any problems with that, Max?
Not that I'm aware of, but we're only meeting 4 times a year anyway.
Yeah.
So we're not gonna be reviewing every single month.
Right. So, you know, but I'm just saying that, you know, I don't have much to do than what we just presented.
And that
3
won't
weeks
guarantee
ago.
either that the financials will be done anyways.
Yeah, understood. Yeah, but it may make it more likely. Does that sound, if that sounds good to everybody?
Will we look at the
You look at it and see what's
calendar for the
possible?
next meeting?
Yeah, sure.
Bring it over
What's
to the next
possible?
meeting.
Okay,
So, I mean, we can review the July again. I can give you an update on the June. You know, what would you prefer? I mean, what kind of information are you really looking for?
anything more on current, Max?
So,
Well, I sent an email out, it was late today, I realize that. But I didn't mean, no, we can answer it now, but I tried to share some information, I've got a copy, and.
do you want him to go through his reports
Yeah,
first? Yeah, 'cause we're there
that's
first.
my question.
We've already done that,
And then-
okay.
Is there anything additional, Max, is what I'm asking?
Other than to see actual monthly disbursements and check registers and things like that, and see some detail. Other than that, those reports are what we get every month, and it's just looking for detail.
Okay. You wanna micromanage? That's fine. I can
I
provide.
don't, hold on. I don't want to micromanage. We've never seen the detail. If we don't see the detail, how can we ask the questions? So I've never, it's not about micromanaging, but we don't ever see the details.
It's fine.
And I've been asking for the details for 2 years.
So you're gonna have to give us some time because that.
I agree. I said, I know you can't answer it right now, but
No,
I'll
no,
give you my
no.
list
So
of what I'd like to talk about.
I'm just answering back. So what you're gonna have to give us some time, and then on top of that, we'll have to look at the costs associated with designing what you want us to design.
I just want you to show me.
It takes reporting though, and it's specialized reporting that we just don't have, and it will take Brent's specialized reporting to design what
Some
you're
of
asking
this
for.
is really easy to provide, some of
Yes.
it is not. And so, I mean.
Well, that's what I want to talk about. Is
Okay.
talk about what's easy.
Okay, what can you easily present on the list at hand?
Well, we can't, we just got the list at 1:30.
Okay,
So to answer that is not gonna be, so
Okay, so-
you have to give us some time to be able to
Okay,
digest
that's
this
my
whole
request
thing.
is that we talk about it.
Like, for example, list of district credit cards. So credit cards that we have on our district, we have American Express and we have Mechanics Bank. American Express, we have one for Eden, one for the clinic, one for the district, and then one that I'm named on in case those 3 people aren't available. And then the next one is Mechanics. We have one for the district, one that I'm named on, and one maintenance is named on. And those are it. Those are all the credit cards. And so you asked for any expense report, CEO and staff. Honestly, Max, there is not expense reports that are outside of a utilization of a credit card, so there's
Okay.
there's not what you can imagine, all these expenses, there is not, except for what's already presented in the monthly reports and the monthly financials. You're asking a summary that includes the line item position costs and even overtime. All those items are within the monthly financials. So there is not not a per se line item. It's a summary and accumulation of the if you want those details, that's where it takes time. So where we provided you, if you recall, in the budget in June, it broke down, because you had asked for that. That's where you're gonna see all those details and how they break down into those departments. That's where the numbers are at, but there's that level of detail is not available except for this summary that you're seeing with that information. So that is provided on a monthly basis. You asked if ACH board members should be attending anyone. So ACHD, so it's not only a budget expense, it's for me, should be budgeted expense, not just for CEO. So there is a travel expense, but there's not an attendance for me per se or board per se. It's just a travel expense. I don't get paid for travel. If you recall in my agreement, there is a stipulation for cars, so I don't ever put miles in. They pay for the hotel. That's it.
They should.
And if I have a meal or two, they pay for that. But outside of that, all the expenses are coming out of my pocket.
So you're paying $1,100 to go, the district's
No,
not
the
paying.
district-
That's what I'm saying, there's costs to go, and those should be budgeted,
It's part of the travel, and it is already in your budget. You guys already approved the budget. Where does it fall under, Brian?
It's under other operating expenses, and
Yeah.
if you want a detail of what's included in other operating expenses, I can provide that. It was in the original budget package, but.
If you go back, it shows you all the line items. If you remember that packet we gave you.
I'll go back and
in
look at
June.
it, I don't remember seeing all the detail, but
It was a pretty big, thick, and I think we gave it again at this meeting as well. So there was 2 times that you had access to that. But take a look at that, you'll see that in there.
And just, in the past, board members have gone.
well, that's why I'm asking, that a board member should go.
Well, but you asked and nobody really was, remember at the board meeting, nobody was really interested in attending, but
I'm very interested in attending, that's why I was bringing the question.
And we said if you wanted to go, go.
yeah, bring it up at the board
Yeah.
meeting, the next board meeting.
Yeah.
It'll be past the time frame because it was,
But
when is
that's,
it, 26?
I don't have, I think that's a good thing to do. I can't right now,
Yeah.
my sister.
I'm not pointing fingers, but so if I go, I'll just bring my receipts in. It's $400, if you stay it's $400 a night to stay at the hotel and $1,100 just to attend. So it's not a cheap thing,
No, it's not.
and it's a lot of money. And that's part of the question is, well, what is budgeted? We have a lump number, I don't know what we budgeted for.
You do, just go back into that line item budget.
Okay.
You have seen that and that's available to you. You ask, I want to break down monthly total payments and reimbursements. So I don't receive anything for attending meetings, ACH meetings. Again, it's except for if I need an overnight stay, it's a hotel and a meal. LAFCO, I don't get anything. Rotary, that's part of the agreement, that's included already.
Right, I was curious what that is, how.
That's already in there.
I
But
know
that
that's
doesn't come
in
to
there,
me.
But I was just curious what those expenses come out to be is what my question is.
And it's every month it's added into our memberships there. Monterey County Economic Commission, nope, I don't get paid anything, so
Okay.
I don't
I was
get paid to
curious. I just
attend
know those things you do, I'm just
meetings.
asking.
And then lastly, you asked a lot of question in reference to the SCIU. There is no contract, all of that's gonna be addressed. And what I can do for you
Agreed.
is that we can invite the attorney to explain the process to you, because I don't want to pretend that I know the process myself. But those details of what you're asking, we can certainly send it to the attorney so that he can give you in closed session what all is involved in that process and the cost that you alluded to.
Right, those numbers don't exist yet, that's the point for
No,
us.
so we're just hypothetically,
That's the
So
point
we
for us
can't do
to
that.
talk about as a finance committee, is what is the impact
We
of
don't
that?
know.
Well, but that's,
We did get a guesstimation on what it would cost for a negotiator. The gentleman that night,
Oh, yeah,
and
but-
it was a
and
guesstimation.
at this moment, we haven't picked one, remember?
Yeah,
That was still part,
exactly.
that's still part of the process. So I would say we can set up a closed session meeting with the attorney, and then he can explain the process to you guys and answer some of those specific questions that you may have. I think that would be a better result than us trying to hypothetically put
Yeah,
numbers out
absolutely.
and think of this and think of that. That's not
And
gonna
it should be a
work.
closed
So
session anyway.
well, this isn't necessary, well, the closed session is working with the negotiator, but this is not something I expect you to answer right now, but as did some brainstorming and some looking, and obviously there's gonna be a lot of expenses with this, you know, and part of the thing is, there is no contract, so the contract will be a brand-new contract.
Mhm.
It's gotta start from scratch. Editing a contract's easier than creating a contract, so there's gonna be a lot of back and forth and a lot of work and a lot of hours into developing that contract, which is a big expense in itself.
So it sounds like you've been involved, you probably know more than I do at this moment. I can't tell you all of those details, I don't know.
And that's why in closed session, we can figure out, after talking
Yeah,
to
and I
someone.
don't wanna be hypothetical
Well,
about
but
it.
the point is, we have to look at the fact it's gonna cost a lot
Absolutely.
of money. And that's why I thought I should bring it up, because we're looking at that. And part of us, what drove us into the union is us making decisions to stop retirement contributions and not give.
If you read what their statement, we only know what's been written in their statement, Max, we can't, maybe you know something
Then I'm making
separately.
an accusation. I'm
Yeah.
saying is,
I
the
would,
reason the union came to us is because people are disgruntled.
but let me
because
ask you, are you in support of them being here or not
I-
in support?
I think a union is gonna cause a lot of expense and a lot of hassle for the district. The reason the union's
But
here
our
is because.
employees wanted that, so we have to respect. And remember the email from our attorneys, we have to stay neutral in these situations.
We have, I'm not being unneutral. We're not talking about what we tell the employees. We're talking about looking at what the financial implications of having this action happen. And part of why it's here is because of the way we've managed things
That's your
over the last
opinion.
couple of years.
That's your opinion.
Here is my opinion, and I'm
And-
stating my opinion.
And you're absolutely right to do that, Max, okay? And I'm gonna stray a little bit, but it's kind of topic. These are all good questions and they should be answered. However, there are other projects that are being worked on. And we have to make sure that we pick and choose what is done, some of the things you need to get done, some of the things other people need to get done. For example, right now, Ida has been looking into how we could get an FQHC certification, which would increase our money. That's one thing she is trying to figure out how we can do. Another thing she's trying to do is she's working with PD and fire to see if we can be somehow a responder in case there's an emergency here in
Talk
town.
about that.
And that is a huge, major responsibility. If we have a shooting up here at the high school, and there are 10 people dancing, which is not a big number, we don't have, the city and the fire department and the ambulance company cannot handle that. Right now, we don't have a situation where we can help out over there. According to the fire department, we need to work with the public health director, got the right person? Get from,
EMS?
the county public health director to get the approval
For the,
to respond to.
it's a department within the public health, yes.
So there are other issues out there as well. So I want you to respect that there are a lot of other issues out there, so that when she says, or Brent says, I can't get all this to you, there are other issues out there, and I just want you to respect that too.
A lot of this should be viewable, is my point.
I'm not arguing with you on that.
So if you go back and look at that budget, you will see what you requested, it is viewable, and you have access to that information. So if you have questions outside of that, then, Brenda or I would be more than happy to address those with you, but we listen to your requests, and so in the budget in June that you approved, the details was there, so that you can see where things are lying in. And at the end of the day, Max, and your comment here, and the mismanagement and those things. Remember, we were in the crust of COVID. We were in the middle of the biggest healthcare crisis there was.
At one time,
Difficult decisions had to be made in order to not only sustain the organization as a whole, but to maintain positions and jobs. None of these decisions that we were made were taken lightly. Now, if you so choose, you talk about the pension, the percentage that we used to give. You guys as a board can decide to allocate that back into the budget, if that's what you so
And the
choose.
board doesn't seem to be interested because I brought it up once and they didn't want to talk about it again, but that's it.
I suggest that you try that again. I think that sometimes, Max, that you bring things up, but not in a way where it requires for a decision to be made, and it's more of a comment. So if there's things that you want decisions to be made, I think that that's how you need to bring them forth and not as a comment. So if that's something you're really strongly about, put it back. We can put it back on the agenda and say, hey, let's see where the support is at. You'll obviously have to make a budget line item because we didn't include that in the budget. I don't know what the impact would be. I have to crunch numbers with our nationwide, and maybe we can start, come up creatively and start more like on a staggered effect rather than a whole impact, so that way we can step into it.
Well, why wasn't it, since it was a temporary stop, why did we not plan to put it back in? We planned in raises, but we didn't plan.
There was
it.
always a plan, but it's up to you guys to include it back in.
And see,
And there hasn't been that. Go ahead.
I'm just gonna say, look at what happened to Hazel Hawkins. They were bankrupt because they did not cut costs. Their CEO was let go because they were in major financial difficulties.
Yes.
So we're fortunate that we were able to stay afloat. We had to make strategic cuts in order to stay afloat. This is the only clinic in Soledad. The Clinic de Salud does not even begin to serve the number of patients it should serve. If we close down because we were stupid enough to go financially ruined and become financially insolvent, this community and a lot of South County would not be with health care. Now, I come to this clinic, and it's important to me that we have that. I can't go to Clinica. You're lucky. You can go to VA and you earned that. Don't ever say that I didn't think that. You earned that. You deserve every bit that you got. I don't have that. I have to have this clinic here. And that's the crucial thing. We serve a lot of people here that would not get served any other way.
And that's what we do, you're correct.
And so if we'd have had to close our doors because we were not financially solvent, we would have done a major disservice to the people we serve.
Agreed.
And that's why the decisions were made that needed to keep us financially solvent. And that's why the decisions are being made to make us financially solvent, so that we can continue to provide the service and expand those services to the people of South County. And that is why the decisions were made.
But if we can't keep consistent employees because we're not paying enough, but we're giving other raises, that is a factor.
But look at what's going on in the schools. They have turnover all the time. It's because there are other places that will pay more. We can't compete with the state. We can't compete with SBMH.
No.
Can I answer to your consistent employee? So I know that you say that many times, but I want you to have as an example of what happened at Eden. When new leadership comes in, and as of what happened at Eden, people tend to navigate and look elsewhere because they don't like the change, Max. They don't want to go through change. You may be better at it, other people are not. So it happened. There was new leadership that came in, Folks didn't want to go through the change, so they looked elsewhere. Guess what's happened at Eden now? All those individuals are all back working for us. Every single one of them. And that is evidence of who we are. And that is evidence of our mission and our values. Our mission and our values is what leads us. 70 to 80% of the people we serve are Medi-Cal patients. Do you know if we opened our doors and we had additional clinics, I want us to talk about at these meetings is how we expand, how we grow, how we go from here, Max. And I don't know, maybe you have ideas. I haven't heard any. That's what I'm hoping to hear from you guys to guide me. But we talked about a mobile clinic. We need a pediatric clinic. We can open 2 other clinics. That's what I'm hoping that we can talk about. We now have our union that's intact. That will help us solidify those relationships with our workforce so that we can continue moving forward. Yes, you see it at a cost, but I see it as a support channel for our staff members. They made the decision. This is what they wanted. It's now our job is to respect that and move forward in the negotiations. We're not there yet. We'll eventually be there. But the decision has been made. We just have to move forward.
And I think we pushed the decision because we're gonna have to give them stuff now that if we gave them some of that before, we wouldn't have the expense of establishing.
That's your speculation, and that's.
Well, you're right.
We don't know. We're not there yet. And even so, if that is the case, then why is that? That's not a terrible thing to do. And it could have been, maybe they have a different creative idea of what staff need and how they want it. And staff maybe didn't have the courage or didn't have the wherewithal to have that discussion with us directly. So now they have a representation who will do that on their behalf.
Which will help them, but.
And that's okay. At the end of the day, we will all be coming out of this
Better.
in a better position than when we started. And isn't that the end goal?
No, that's the goal. And again, you said you made decisions that were bad, that got us in this situation. The decisions that you're referring to were required in order to keep our doors open. So if they were not bad decisions would have closed our doors permanently. Those would have been bad decisions, because we need to provide the service in this community. There are so many people that need this service. And so it's my opinion those weren't bad decisions because they kept our doors open. They kept us solvent. They kept us providing the service. And as Ida's right, we need to figure out how to expand our services.
Agree with expanding services.
Okay. Max is raising this paragraph here. Where the budget and the approval and all that stuff, I'd like to get that dang thing put to bed. Can we have Ida,
What are we talking about?
this one right here.
The annual budget? That was approved in June.
Yeah, but he's saying
We
that we didn't
approved
talk.
a preliminary budget.
We
No,
said,
no, it was a proposed budget. I'm just saying what we approved. I brought it says it was a proposed budget for 2024.
No, he's saying that we're not following the procedure. Noel says we are following the procedure.
Yes, I did check in with her.
And so let's get,
Well, Noel didn't say we're following the procedure. Noel said, well, that's how all our districts do it.
I'm
I
going,
mean, I can show you what the law says right here. I brought it.
I checked with her, so this is what she replied. She says she apologizes, but she didn't have time. She says, hi, I'm on the road returning from a meeting, so unable to comment extensively on the issues raised. I can tell you that 6110 is for Community Services District, which we are not.
I've had that conversation. I'm gonna speak.
okay,
I talked to Noel. Noel sent me this stuff and says, oh, we use the health and safety code,
Yes.
even though they revert to the government code a lot. The health and safety code says adopt an annual budget in a public meeting on or before December 1st that conforms to generally accepted accounting practice and budgeting procedures for special districts. Well, budgeting procedure for special districts is 61110. So the health and safety code covers all the medical things, and it refers you to the government code for the admin things. And the government code says have a preliminary budget by July 1st and have a formal budget by September 1st after having a public budget meeting. I watched the city of Soledad, and they have a
But
meeting
they're
just on...
government. They're city government. They're not
That
health and
whole-
safety code.
go on next.
Health and safety code is not the point. They're a government entity. We are very similar to a city council. We're different, but the government code follows the same policies.
But that's the point that she said, I shared this with Director Schell, but perhaps you didn't see it in my email.
She shared it with me, and that's what I'm telling you. She referenced me to the health and safety code,
Yeah.
which says for budgeting, but you're supposed to do this in accordance with the budgeting procedures for special districts,
Yeah.
which is 61110. And that's the same thing that city councils use and all other districts use. That's the government code that says how you do budgets.
Can we have Noel?
Yeah, no, she'll
Well, she's
reply.
already, I've had this conversation with her,
Oh,
and that's what she says, but I think
I
she's
want-
wrong.
She's our lawyer. So,
Okay,
I want,
and get a second opinion.
you really want to incur that cost?
No, and I want to resolve it.
which,
So when it is resolved, our attorney applied,
Okay,
replied.
then I'm done for now. I'll do my own
Can-
research and I'll come
can
back.
we get Noel, the next board meeting, let's put this to bed.
Okay, do you want her to reply to that?
And be on, available during the meeting.
Okay, we can do that.
Thank you.
So can I show you something real quick?
Yes, sir, please.
This is an example of a listing of checks for each month. Is that what you're looking for?
It would be a start to be able, I can look and ask questions and to see some breakdowns and identify.
Because you're asking for register, disbursement, and invoices, so I don't know exactly what you want.
Well, obviously,
Do you want
Because if you
things
do
that are in excess of a certain dollar amount? Do you want to see every line item?
well, originally that, it'd be nice to see what we spend our money on. And again, to go to the city of Soledad has a much bigger budget than we do, and every disbursement is listed, and you can look them up. You can go to their website, and you can see that.
So, but I need to know what you want to see on that listing. Do you want to see, do you want to see the breakdown? For example, a credit card. We may pay $28,000 on a credit card, but it is allocated to 18 different disbursement codes. What, do you want to see the allocation, or do you just want to see how much we spent to the
I'd like to see the detail. That's what I'm
Okay,
looking
so
at.
that's the, okay, so, because I can print out, a listing of all the checks, but it won't give you the allocation to every different department. If you want to see the allocation to every different department, that takes a little more time.
All right.
Well,
I will
I just want to, I
come
don't want
back.
to provide something
I-
and you tell me that's not what I wanted.
Before you provide anything, I will come back with more specific requests.
Okay,
Okay,
That
I'll
would be
make sure,
helpful.
I'll make sure the request is clear,
okay.
because that's, the goal is clear, is not to make it worse or harder.
appreciate that.
monthly budget review, did, I don't know where we are on that, I just apologize for that.
No, so we presented the budget, budget to actual comparison as of July 31st. The 1 month budget for that period, for example, for Eden Valley, was to make $77,000 basically per month, and Eden Valley made $141,000 the first month, so it was $64,000.
And if I can share a little bit of news behind that. So year over year, our visit counts at the clinic are down by 1,200. So I just met with leadership team on Monday, making sure that they're maximizing the available schedules, because what happens if you look at our cancellation rate, 50% cancellation happen, if not within the day, within the week. And they don't get filled in again. So those, it's apparent when you look at the year over year, the visit counts year over year are dropping by 1,000. That's a big swing when you look at our finances. And so making sure that, and meeting with the leadership team, making sure that at the clinic that any opportunity for a visit is filled and is available. Some good news I can share with you guys, and I shared with you guys at the last meeting that CBI changed their mechanisms and how we're getting paid for CBI. So last year Max alluded to, oh, we're getting less. Well, yes, that was true because CBI changed their reward system. So today I just received the quarterly report for CBI and to kind of show us how we're doing year to date. So if all goes well, we can guesstimate the amount for the quarter can go as little as 450,000 to as high as 700,000. Think about where we were at last year. They weren't giving away that many dollars. Now, that's all making sure that all the benchmarks for the CCAH patients are being met. And I can tell you that there is an attention by the team and the leadership team over there to make sure that we are hitting all the marks. One of the areas is the discharge care. So if you went to the hospital, we have to see you and admit you within a window of time in order to get credit. So we didn't get full credit and points on that because we seen 10 less patients. That's how minute these numbers are. So we didn't see 10, we seen 10 less patients, so they didn't give us credit for that.
How are you notified that someone's gone to the hospital? Let's say I'm transported, or Pat takes me, and I'm in the emergency room. Does the hospital notify you that I've been there, or does that work?
Great question. We actually have to log into the CCAH database and download those visits daily. And then we have to make sure that the visit appointment is scheduled. And normally the caseworkers, before you exit the hospital, will give you an appointment. But that doesn't mean that the patient comes.
Because the reason I'm asking that is Pat took me to the emergency room. I was put in I was in the emergency room, and they put me in a bed, and then they sent me home. Because whatever happened was somewhat resolved. I don't know if that was ever flagged so that you could have then had me have an appointment. That's my question.
So this program is specifically designed for Medi-Cal patients.
Oh, well, that excludes me then. Okay, now I understand.
This is a reward for Medi-Cal patients. This is part of their care access program that they have.
Okay, but that goes back, that even if you'd been notified, you call me in, there would have been money from Medicare.
Prospectively.
Yeah, and
So we have a separate program. We have a care management program that, for example, you can be a part of. So anybody who's on Medicare, we have about 350 patients enrolled in that. And that is a one-on-one care management program that is there designed to take care of you every day. So you have access to a 24-hour nurse line. You can get text messages every day, but you have to be willing to sign up. That would have notified them that you were in the hospital. They would have called and set an appointment.
Yeah, that was because I'm trying to figure out how to increase our number of appointments. That was the point of that, my roundabout. I apologize for that, but that was the point.
I mean, the opportunities are there. What we need to do better, I'll give you a prime example. The other day, a brand new patient comes in, and the front office staff member indicated we aren't accepting any new patients and turned them away. Well, that is not the case. We are accepting new patients. It just happens that under the CCH program, we're not adding new CCH programs until we can get our quotas in line. That's where that came from. They kind of took it as, oh, it's all new patients.
Yeah.
That's not the case. So that was fixed right away with that. The other thing is preventative visits, preventable visits. So those are the ones, again, that they went to the ER, but I had a cold. I have an ingrown toenail. Things that could be done at a clinic level should be done. So those are the only two areas that we can improve upon, but so far our numbers are looking strong, and there's a lot of attention being put to this so that we can get a better, result at the end of the year from CBI. So some good news. I just wanted to share some good news.
Sounds good. Anything else?
Fran, is there anything on your end?
No, still waiting for the PTO report from,
Okay,
so if you could make a note of that.
yep.
I need that in order to finalize the year end. I think I've received most everything else at this point.
We can work on that.
Oh, you sent me the inventory for the clinic or even ballet, I can't remember, but I'm missing the other one.
Okay.
I'll look at it and send you the email.
Okay,
One of them, you sent me the inventory for one of them, I don't have the other.
so you need the other, I think it was clinics, so we owe you Eden.
Yeah.
Some other things for you guys to think about. We are experiencing some issues with our sewer system.
Sure.
I just had cameras coming in today. I haven't got the full report from maintenance. I'm waiting on getting the full report. In essence, what we found is there was an upgrade to half of our sewer system on this side of the building. But the sewer, the part that was fixed, there's a kink and it's going down. And what it's causing a backlog. So we may have to go back, and we already met with architects on it to review it. They want to see the camera. The architects brought down the engineers and their people as well to look at it. So that may be an added cost that we may have to incur. So I will let you guys.
Did we budget something that we were gonna look at in last year that we carried over to this year?
So asphalt, it was the asphalt and the, I don't have my budget in front, but asphalt was, I think, the carryover.
Okay,
We just finished that project.
okay.
Yeah.
All right.
But there was no other major
I thought
projects.
there
So
was a
just,
sewer something, but,
just keep that in mind. We continue to do the upgrade to technology and equipment. So one of the things that you guys will find is that technology and equipment, as soon as you bring it in, it's outdated.
Yeah.
Okay, it's like that brand new car you drive off the parking lot and it's already old. So we are upgrading our like internet connection systems, our Wi-Fi systems, and we're doing it a section at a time. So we did Eden Valley, we just did one, did one at the clinic. There's a couple more that we need to do throughout. And that comes at a cost. It's not,
Nothing's cheap.
nothing's cheap. I'm trying to balance it out with our expenses and trying to kind of, push it out a little bit further. The other big picture thing is that we need to think about is in January of next year, although Brent has it in our budget, is we will have to take some of that cash and pay off the PPS. So we'll have to come up and you send it in an email, part of your attachment with CSDA in reference to, when to get lending, how to get lending, those kind of things. Bottom line, at the end of the day, you do want to, lean on your partners to do financing as much as we can. But the goal is hopefully to pay it out of cash, keep enough cash so that we have a little bit of a reserve, but that will take a lot of our cash. And we estimated for 2023, 1.5 million that we owe.
mhm.
So August 1st, we did sign the report to stop that, but it wasn't completely, it was only part of it. We will have to sign a new one in 2024, so we're roughly about 400,000, but you guys will see the numbers already impacting our finances. And I'm already seeing it on my end, so it's equivalent to about $125,000 a month, okay? But on top of the
That we don't get because they're not overpaying us anymore.
correct, and then on top of that, when the census is lower, or when the clinic's visit count is down, that's accumulation. So I'm seeing a drop of about $200,000 a month. What it means is that we have to now live within our means. Okay, so we're having to live within our means is what it means, but it means that we also have to kind of work and manage the daily expenses.
Yeah.
So that's what I try to work on, in making sure that those expenses are spread out and they're not all happening at once, in order to make that impact that we're having not so dramatic on our finances. But you guys will see a number decline, and that's because we've made that decision. And I think it's a
It's
good
a good one,
decision.
we have to.
It's going back to living within our means, but it did cost us about $125,000.
We gotta stop digging the hole.
Yes, please.
But, we budgeted, last year we budgeted that, it was basically 125,000 a month,
Yeah.
so. You just don't have to budget it anymore because it's all just part of the revenues.
Yeah, thank goodness. So just an FYI, so there is those kind of decisions and changes that are being made so that we can, hopefully the goal is turn it around, keep up the census, keep up the visit counts so that we can, pay for all of these. You ask, how much do we pay for each month? It's $1 million. I mean, it's not cheap. $1 million is what it costs us to operate right now.
But see, the other part of the conversation, and some of this is way behind because we already built the Women's Center, but that's when we're talking about capital plans and planning. We don't have any reserves because we just have our cash. And for example, something like the Women's Center, we took that out of our money and we ran out of money, so we had to borrow money. If we do a project like that, even a major repair to the plumbing, and you finance that over 10 years or so and capitalize that out, now the next generation's paying for that repair while you're operating without taking all your cash and not having any cash. That's something to look at that never has been done here.
It's a tough decision, and even when making decisions on repairs, they're tough decisions, but some of them are necessary and they can't go without. So I think that we can certainly look at kind of getting a kind of a heat map of what's coming up. So I did task managers with kind of looking at their buildings, working with maintenance and seeing where that lies. But at the end of the day, sometimes emergencies do come up and we have no choice but to act and react. And even with the budget, again, a budget is a guide.
Correct.
But we're a living organization, so those budget categories can change because of our given situation. I mean, at this moment, I hope, that to lessen the finance burden, but if that's the way that we need to go at the moment, then that's the direction that we have. And my goal is, and I was putting away, and you knew we were putting away about $125 a month, trying to prepare for the payment to come. So there is a deliberate, but you're right, decisions that were made prior to me getting here. There was no budget plan, and there was no standardization. There was none of these elements that you see today, Max, that were in existence before I got here. There was no automation. What you see that Brent has provided, that would have been very difficult because there was no, now medical records is electronic, accounts payables electronic. That automation and standardization did not exist prior to me arriving, and decisions were made on projects, unfortunately, that were not planned out thoroughly.
Nope.
And so we, now the folks that are here have to reap those repercussions, and now we have to deal with that. And one of them is our cash flow. We, have to manage to what little cash flow that we have to kind of keep things afloat until expenses get down and we can increase our census and our visit count. When I came here, census was 20. I think the lowest it was 10. So that's a detriment.
Oh.
Now we can easily be comfortable with saying our census is right around 47 to 49. I think we budgeted about 49 this year. Okay? People, we've been able to hire way more people now in our community because of it.
Yeah.
So we are doing a service to our community because we're able to hire more and able to hire local. And so we should be proud of that aspect of it. But yes, I think there is more of those high cost expenses that we need to consider that, these buildings are 30 years old, things are going to start breaking down.
Yep.
So you got to do it at a piece at a time. You can't do it all at one time.
And you got to plan it.
And you have to plan it because it takes money, time, and resources
Yep.
to do it. Mm-hmm.
Okay, anything else?
No.
Max?
No.
Okay,
So just to summarize then, I'm waiting for you to tell me exactly what you want.
Yes, I'll be
Okay.
more specific so that it won't be a waste of time.
All right.
okay. Meeting's adjourned.
Thank you, everyone.
Thank you.